Hi, hello, and welcome to the InvestGhana Podcast. This is a podcast by Ghana Investment Promotion Center where we discuss the economic future of Ghana and investment. So today we are coming from the Labadi Beach Hotel in Accra, and I have two distinguished guests with me today. I have Dr. Koby Appiah-Sakyi, the CEO of Britannia Medical Center, and then Dr. Asheley Ashietey of Noble Wellness Center. We're going to talk about something very interesting today, how we can improve medical tourism in Ghana. How can Ghana become the point where people fly to receive medical care? Join us today for the conversation. My name is Dr. Joel Sackey. I'm a medicine resident. Ladies and gentlemen, welcome.
Thank you very much.
Okay, so let's talk about medical tourism in Ghana. So I had three friends, okay. One of them went to America for a laser eye surgery. Another friend went to India because she had a tumor in her eye. Then this person, this was a patient, okay, was a 6-month-old patient who had a liver failure, was born with it. So the family was trying to raise funds and go to India for a liver transplant. The question is, why do they have to go out? Why can we have the reverse and have people fly into Ghana to receive such care, whether it's cosmetic procedures, whether it's life-saving procedures? Why isn't Ghana the hub for medical tourism? What do you think?
Well, that's a really good question. And the context you build around the questions, to some degree, explains why they have to travel. Okay. Ghana traditionally has been a home for the sub-region seeking care. So Nigerians, Chadians come to Ghana for healthcare. That's been going on since independence. And a lot of the care that we get in Ghana is of much higher standard than you get in the sub-region. Okay. So it is happening that people do come into Ghana to get healthcare. The context you describe, these are very, very specialized surgeries. Liver transplant is not done in Ghana, but kidney transplant happens in Ghana in several hospitals. Very, very complex eye surgeries. So these are things that are at the moment not available in Ghana. But outside of these examples, there's a lot of cancer care, fertility treatments, cosmetic dentistry, orthopedics. These sorts of things are available in Ghana. And the sad thing is a lot of Ghanaians don't even know that these procedures are available.
Okay. So, Dr. Now, why do you think people don't know about it? Do you think we have a marketing problem? Do you think that as doctors or in the medical field, things are not said as they should be said? We are not on maybe social media, maybe we are not on news much. What do you think the problem is?
I think that a lot more awareness has to be created around what is available. Most people don't even know that they can have some of these procedures here. You know, they rather see on social media people from the West advertising, for some of these services. So they would follow that and not know that there are hospitals or medical centers right here where they could have these same services. So I do think that we need to work on advertising our own more. Like Dr. Koby just said, there are a lot of things that you don't need to leave Ghana for, but it's just a lot of people don't realize that they can have these services here.
Okay, so are you saying that the biggest problem we have is advertisement?
It's marketing.
It's marketing. That's what you say.
And you see, and to Na's point, you go to Dubai, you land at the airport, and you see adverts from Turkey, India. So they are advertising very, very. They even come to Ghana to get clients to go to India.
Right.
So it's just the degree of marketing the different countries are doing, and Ghana is just not putting its foot forward at all.
Why would that be? Because if that is how we get clients and get even. Because, we have that December, people flying to Ghana for parties and all that. So why can't we have that happening in regards to medical tourism? Why don't we have that level of advertisement or marketing when it comes to that aspect of the economy?
So as I alluded to before, Ghana has been doing so much for the sub-region, but very little very little noise is made of it. People come into Ghana, probably even get an NHIS card, and then go to any hospital, get treated. But they are not Ghanaians. And we just don't pay attention to that. Medical tourism is somebody traveling from his country to another country to get healthcare. And when you get healthcare in another country, you don't pay the same price a Ghanaian pays.
No, you don't.
But in Ghana, we just don't have the systems that capture that kind of extra revenue that we're supposed to have. It's just now that we're starting to put these things together. So if we don't have it, we obviously don't benefit from it. We have to learn from the Indians. We have to learn from the Turkish. Medical tourism in its form now is actually some of the biggest revenue earners for some countries, Thailand,
Okay.
Singapore, even Dubai. Do you understand? But it's just that there's an active program to ensure that people know about what is available and also closing the gaps of what is not available. Because people are just not able to afford, even those in the West are not able to afford cardiac surgery, for example. So they'll fly out to Thailand to do and get it for half a price. And we do cardiac surgery here in Ghana, but very few people know. So back to what you were saying about the December. You know, we have over 1 million people come through Ghana in December.
Wow.
We do cosmetic surgery here.
Yeah, we do.
Okay, but people don't know about it. A lot of these travelers like cosmetic surgery,
Yeah.
but we don't make noise about it. But we have some of the fantastic cosmetic surgeons, a lot of them Western trained, that are able to do these things, but we just don't make noise about it.
Funny to mention that. Like, I was in hospital yesterday. As a patient who came in with an infection of a different kind, but she had a cosmetic procedure done, a BBL done in Ghana, and not to like probably 2 weeks before. She said that she had married a younger man, wanted to look younger. She had a tummy tuck, a liposuction, a BBL done. And I was also surprised, even as a doctor, to know that it was just done almost next door, right here. So I don't think, so the opportunity exists in Ghana, but I think that
we haven't created the niche for it. I feel like, if you're traveling to Dubai, it's Dubai.
Yeah,
it's
exactly.
almost like a holiday destination, but
exactly.
then you get the feel of having to do all your tests and all of that there. So I think we haven't created that niche for the medical tourism, even though we have the professionals, we have the equipment and all of that. We need to make the environment conducive for people to want to travel, to be able to, and have some holiday maybe, and also receive that medical treatment that they need.
To point to that, how can we make the environment conducive? For example, let's say someone comes from Nigeria or from Swaziland or wherever, Eswatini, wherever, comes to Ghana for medical care. How would it be easy for the person to access the healthcare? Because I don't know whether we just Google the place, where would I stay? What are the price? How would it be easy for me to have healthcare if I come to Ghana? What do you think some things we can do to help that?
So the countries that are benefiting from this have very standardized infrastructure that have built, or a framework that have been built around this whole thing. You don't just go into Thailand and then go find, before you get there, they already have contacted you. You actually already have a teleconsultation with a specialist you are going to meet. They have a meet and greet at the airport. They have a hotel arranged for you. There's a car rental that picks you up from the hotel to see the consultant. Everything is structured and monitored. Even the language, the religion that you're in, all of those things are picked up. So they serve you to the very limit of your need. And that is really what we should be doing. In fact, at the moment, the African Medical Tourism Council, which I'm a president of, is a group of 10 hospitals here in Accra that are trying to put that infrastructure together. Because you need that first before you be able to meet the need that is out there. Nigeria loses $6 billion every year from medical tourism. That's a huge number of people getting out of Nigeria. And we could actually pick up a good percentage of that if we're doing what we have to do. But you have to put all these processes together, and you also have to get some government support to make that happen.
Okay. So back to government support. Do you think the industry should be pushed first by the private sector or by the government? What do you think, or a sort of collaboration?
In every place where medical tourism has thrived, it was driven by the private sector, supported by government.
Okay.
So when you go on CNN, you get the amazing Thailand adverts. Now that's government.
Yeah.
Okay. But behind that is private sector that provides the hotel, the car rentals, the good hospitals, etc., etc., etc. So it's a partnership between government and private sector to make this happen.
Okay, now let's say technology, Dr. Na. How do you think that we can incorporate technology into what we are doing? For example, I saw recently that someone did a surgery, I don't know, it was China, and they were like 100 miles away, 1,000 miles away, and like they were operating on someone in a different town, several miles away. So that sort of didn't require the doctor to be there at that moment. So I was wondering the place of technology in this. Like, how can technology help us become a hub for medical tourism? Do you think that we need more apps? We need more, like, for example, a centralized place where you can find all the cardiac centers in Ghana on one platform, or all the neurosurgical places in Ghana on one platform? Or is there a place for technology in the conversation?
Absolutely. I think now there are a lot of AI-driven medical technologies, and I think in Ghana we haven't tapped into that yet at all. So that's a good place to start. There are ways to, check biological age and all these things, see how your organs are functioning. There are a lot of diagnostics, for instance, that again, in the sub-region, even though Ghana is probably doing better than a lot of the countries around, that I think can be invested in, so that you know that when you go to Ghana on a certain weekend, you can get all these things done. There could be collaborations, public hospitals, private hospitals, where you know that you can get these done. I'm not sure if we're at the point where we can do virtual
operations,
consultations and all that yet. But yes, I think it's a very good place to start. Technology is huge now, especially in the medical field.
Yeah.
There's all sorts of trends and all sorts of things out there, and I think that we should make ourselves ready to be able to learn and get into some of these things as well.
Let's talk about the challenges in the medical world. We mentioned marketing. That's one reason why people don't come. But I think there must be other things, maybe infrastructure, maybe the personnel involved. I don't know. Even one challenge was let's say hotel accommodation stuff that may not necessarily be seen by the average person. But what do you think are some challenges that we experience that can help or that we should overcome in order to improve medical tourism in Ghana? Koby, what do you think?
So for me, there are 4 key areas that we need to look at.
Okay.
The first, in my view, is skill gap. You describe these processes that, or these surgeries that these individuals needed.
The liver transplant,
exactly.
Yeah.
So there's a skill gap where there's certain procedures that are just not available here in Ghana, and we're the first to admit that. There's also technology gap. And again, back to our conversations around technology. And the technology is on many levels. Social media, we're not just present there. The technologies that we need to provide surgery that we don't have here. Give you an example. So if you're going to do spinal surgery for a patient who's had cancer, prostate cancer, and it's traveled into the spine, there's a particular kind of radio waves that you use. We call it gamma knife. Now, the whole sub-region doesn't have a gamma knife. Okay, think about it. So there's technology gaps that we don't have. You're talking about surgery that is done across distance, remotely. Again, you just have to get a robot and somebody skilled should sit somewhere and do it. We're not far away from these things, but we just don't have a robot that does the Da Vinci robot that does the surgery. We just don't have it in Ghana. So these are the technology gaps that we just have to close. The next one is process gap. Process gap is what I described. When somebody comes or somebody says, okay, I'm not well, I want to go to Ghana, he's on the table being operated. That whole process has to be mapped out and every bit of the workflow sorted out by somebody. The process gap is what, as I said, the African Medical Tourism Council is working on now to be able to get that close. And then there's also a knowledge gap.
Okay.
There's things that we just don't know about, so we just can't deliver.
Knowledge from the medical
That's correct.
Professionals.
Yes, that's right. So one of the things we need to do is to upscale the eye surgeon to be able to do some of these complex ones that you can.
Okay. What do you think, Dr. Do you think, maybe, let's say the knowledge gap, do we have to, let's say, open certain training centers in Ghana? Do we have to sponsor people to travel to get that skill and come back to Ghana? What do you think? How do you think we can overcome such challenges?
Yeah, so the knowledge gap is huge. Even in my field, as a chiropractor, there are just not that many chiropractors in Ghana and in the sub-region as a whole. So somebody has back pain and they may not know that there's a chiropractor right here in Accra, and they may find themselves all the way somewhere in Europe or some other place just to receive a chiropractic adjustment. And also sometimes, unfortunately, people don't believe that we have that skill, you know. So there's a problem of trust. Yeah. You know, we don't trust that a Ghanaian chiropractor can fix the spine. So we would rather want to travel to Dubai just to receive this. So
why do you think that is? Why do you think we have trust issues as Ghanaians? Why don't we trust ourselves?
I don't know. I think we still have the mentality of trusting our colonial masters, maybe.
Okay.
And that's rather unfortunate, because
Yeah.
there are a lot of people that have done proper accredited training to be able to provide these services, but we still want to go outside and receive this. So it boils down to the marketing that Dr. Koby talked about. We haven't branded ourselves well enough. We haven't marketed ourselves well enough. I mean, in my space where we're looking at preventive medicine, it's almost as if it doesn't exist.
Yeah.
Even for us as a people. So talk less of somebody who is outside of Ghana who wants to just stay healthy. They'll rather go to Singapore or South Korea,
Yeah.
any of these Asian countries, to go and receive preventive medicine.
Funny you mentioned Singapore. I was in Korea, not too long ago, like 5 years ago. I met a surgeon there. He said that he does two kidney transplants a day and 1 liver transplant a day. So every day he has three different transplant surgeries. I was like, I mean, when he said it, I was taken aback, because in Ghana we are far from 3 a day. We are far from 3 a day. So I noticed there's the gap in what we offer and what we can provide. But I think that the potential is there. I think that in the medical field we can actually bridge the gap that is there. If we like, let's say we have these things you address, the marketing, the knowledge, the training that different specialties can get, and we can able to bridge that gap sooner than we think. So let's say 20 years, let's say we are in 2046. What do you think has changed in our field, and that has made Ghana a medical tourism hub? What do you think would have changed? What do you think what's the first step we should take practically today, if we could take a step?
That's a really good question. Now, but before I deal with that, let me just add something to what Dr. Nas said, that you have to appreciate that when people come into countries to look for healthcare, it's not always because they are sick. In fact, a large number of people that go to Thailand go for medical checkup.
Okay.
Just medical checkup. So if we actually are looking at the preventative type care and provide that very well, that in itself has a huge market. And if you are looking at so you're looking at wellness, we're talking off camera on sauna and physiotherapy and these sorts of things. That's also a whole area
avenue,
that we could explore, particularly because of the December in Ghana and the number of people that come through Ghana.
Yeah.
So if we have packages that involve wellness and spend a little bit of time in the beach in Akosombo or something, people will jump on. Exactly, people jump on the waterfall, and we just don't market it enough. Now, to now answer your question, that's a really important question. How do we get from here to 2046, where all of these things are sorted out? I think first and foremost, we have to understand the revenue that is associated with this, because we are not starting from the ground. We basically already provide healthcare for a lot of foreigners. I was speaking to somebody from UGMC a few weeks ago. He was telling me that the United Nations office, I think it's Abidjan or someplace, they send all their staff here for medical checkup every year.
Wow.
And that's not the first time I've heard that.
Okay.
So Ghana is just the an attraction for healthcare in that sort of way. But we have to be purposeful about it. Hitherto, we've just, we're there, Ghana, come, and we can't continue with this. We can't solve this problem this way. We have to be very intentional about it. So the hospitals need to come together. The governments must understand what we're talking about. If somebody comes to Ghana and get a knee transplant or a kidney transplant, now this is upwards of $50,000. That's just healthcare.
Yeah. Before
the hotel services, they normally will come with 3 or 4 people.
Yeah.
They will use a car rental. They would be in hotels. The business overlay is so big that you definitely do need government to appreciate and support it.
Yeah.
So when you've done the initial work of getting the systems working like we're doing right now, then you look at the gaps. Where are the gaps? So these are the gaps. You need to upskill. So in Ghana, there's a certain level of cardiac surgery we do, but we don't do everything.
Yeah.
That's the reason why people are going to Thailand.
Place,
So can we now close those gaps? Then you go to technology. What are the technologies that we need? We need to now bring those technologies in. The reason I was talking about Gamma Knife few moments ago is because I spoke to a neurosurgeon from Germany, a Ghanaian who trained in Germany, saying that, there's so many Ghanaians in New York, neurosurgeons. And we're talking about trust.
So why? So when talking about that, why don't they want to come to Ghana to bring that skill here in order to improve medical tourism? So why should we fly to Germany to see him? Why doesn't he bring that skill to Ghana so that we have people flying to see him? I know that, yeah.
So well, the conversation was about he bringing Gamma Knife to this country, and I was encouraging him to do that.
He should.
But the point is, there's still a lot of worry about, I'm coming to set up, the system just doesn't, ambulance doesn't work, there's no blood, there's no water, light is gone off, those kinds of things. So these are things that we have to solve. These are problems that are real problems that deter people from coming home. But all we're saying is that currently there are quite a number of hospitals that are doing reasonably well. We have to start from where we are.
Yeah.
And if we continue to set up, we in Britannia are just building our phase 2, and that's a much bigger hospital with a lot of facilities in there. So as we do this, and a lot of modern hospitals also coming in to Accra.
A lot of hospitals.
So in the next 10 years, back to your conversation about 2046, there'll be a lot of modern hospitals here. We'll be doing so much better. And of course, if we are to continue to attract Ghanaians who are working in other parts of the world, we'll be able to get to where Ghana truly will become the medical hub that it should be.
We have very skilled workers who are just not in Ghana. Yeah. And we have the brain drain that's happening all the time. Yeah. We are losing our brains in code to other places, but we have the potential. Okay, so let's talk about collaboration between the government, private sectors, healthcare providers. What do you think we need to do as a country or as a system to improve the medical tourism? How do you think I collaborate effectively?
Yeah, so I think that a very intentional, purposeful collaboration between governments, insurance companies, public hospitals, private hospitals, everybody coming together. I studied in the US, and I know that, for instance, the insurance companies work so well with private organizations, to be able to continue working in a certain company, you should have done certain medical tests by the start of the year. Otherwise, you can't come to work, pretty much. So that's a very good way to start that collaboration to get people healthy by making sure they run their tests, their diagnostics, their lab tests at the beginning of the year or by a birthday, for instance. So I think if everybody comes together that way, it would also go a long way to help.
Yeah, I think so too, because for example, the mandatory lab tests, Ghanaians do not, we don't like going to the hospital. I don't get it.
No, we like to wait till dying
dying, and then you now go to hospital for doctors to perform magic. It doesn't, but we don't necessarily focus on the preventive part, where it's like, do your basic test, because even 3 to 6 months, you're supposed to do your basic test every 3 to 6 months, but we don't do it.
Yes.
You want to be sick, and then, because I work in a hospital where we offer, like, let's say every 6 months, offer a package where it's like a wellness package, come and do your test. You have to force them to come in. It's like, it's your health. Don't you care about your health? It's like, you have to force them to come in. So I think that will really be effective. Yes. And then let's take investment. If you take the Ghanaian field, do you think our market is open to foreign investment in the medical field? I know that, let's say, Ghana is rich in resources, in gold, and then whatever field there is. But do you think that we are open to investment for the medical field in specific? What do you think, Dr. Koby?
Absolutely. So I did say that over the past sort of 6 to 10 years, there have been a lot of modern hospitals that have been built in Ghana. But if you go into them, they all have areas where they would love to upgrade, upscale, but they just don't have maybe the investment that would allow us to be able to do that. So I know UGMC has a phase 2 that they are, and that's a lot of, again, investment that is required. And a lot of these modern hospitals, Bank Hospital, ourselves, are all looking to expand what we already are doing. So there's a huge opportunity for investing certainly in the health industry here in Ghana. And with the government's interest in, making this place a health hub, not just for the sub-region, but certainly for our tourists that come into Ghana, I think there's a big opportunity here. We in the African Medical Tourism are talking about starting a cosmetic surgery hub here in Accra. And that's a huge money maker, cosmetic surgery and tourism. So there's definitely opportunities. And I think if investors are looking to invest, this is an area they definitely should look at. Okay. And we will be very interested in talking to them.
I was thinking about this. What do you think that as Ghana, we should focus on one particular field. Let's say we are experts in this. Let's take Turkey. Turkey is known for cosmetic procedures.
Right.
You want a hair transplant, go to Turkey. You want a BBL, go to Turkey. Do you think that as a nation, we should focus on one? Let's say we are the experts in liver transplants in the world. So if anybody's looking, or we should have a broad sort of spectrum, we can do a bit of everything. I don't know. What do you think?
So it's almost a modus operandi, right? When Thailand started, American trained Thai people just left America and went to Thai and started cosmetic surgery. So the big Thailand name for medical choice actually just started with cosmetic surgery. It's very important to be, a master of something rather than be sort of, a jack of everything.
Right.
So I think that it's better for us to focus on a few things, because in that way you can upscale in that particular area significantly and make a name and a brand for yourself. So that's why we are talking about cosmetic surgery. Thailand did it that way. Dubai, to some degree, has done it that way. Turkey has done it this way. India was a bit more broad, but then India had a lot of tertiary hospitals when they started. So I think that we in Ghana too must focus on a few things and do it extremely well. As we have a cardiac surgery, we have a cancer center here in Ghana, we have very good orthopedic service. There are a few things that we should do and do extremely well. And then, Michael Obeng, the plastic surgeon, the well-known plastic surgeon, was talking to us. We should be able to set up a very good cosmetic surgery because of people like him and other very good Ghanaians who are very good cosmetic surgeons. So that's one focus that we intend to do. Just focus on that and build that up. Because when people come in December, they know they can come and have fun and also do their plastic surgery. That's how you sell the country.
Have fun and do your BBLs. yeah. So I think I think that people may want to focus on the, let's say, life-saving procedures as opposed to the cosmetic procedures. For example, in our nation, we have a lot of kidney problems because of the diabetes, hypertension, and heart problems too. So it's like if you focus on, let's say, kidneys, we do kidney transplant. If you do 100 a day, 1,000 a day, it's like Ghana becomes the kidney hub of the world, or it's something that, first of all, people need in the country. Because we see people all the time on dialysis because their kidneys are not working anymore, and the dialysis doesn't solve. It's not the definitive treatment. You need to have a transplant, and it's like we need people. Like people here need it. So if we become like sort of the hub for, let's say, kidney transplants or the hub for cardiac surgeries because of the hypertension we are prone to and all that, it could really become a center of excellence for the world, and people will fly in for all that. But yeah, preventive care, I think it starts from that, to be honest.
Right.
We don't want you to get to a stage where you need a kidney.
Yeah,
correct.
We don't want you to get to a stage where you need a new heart or a heart surgery. We want to prevent you more than cure you. So yeah,
right.
I think the conversation is a very important conversation to have. So if I give you, Dr. Na, $100 million now to invest into the health system, to improve medical system, what would you invest in?
Me personally, I would go into preventive medicine. I would go into longevity, anti-aging. We all want to stay young as much as possible. So for me, I would go into the diagnostics to detect things early. That way, once it's detected early, we reduce mortality and things like that. So I think that's a blue ocean niche that is really open for whoever wants to invest in the health or medical space in Ghana, because we're just not doing that. And we have the terrain, we have the coastline, we have the waterfalls, we have sunlight. Everything, the sunlight, a lot of it, is peaceful. So I think that we as Ghanaians need to start looking into how to stay healthy, first of all, by doing the basics, getting the sunlight, looking at our food, nutrition, exercise, and all of that. So if I had a huge lump sum of money, for me, I would look into that. And also realizing that Ghana is not just Accra. We have people in the north who still have to travel all the way to come to Accra to get an MRI scan, which is totally ridiculous. So I would definitely invest in preventive medicine. I would invest in diagnostics, PET scans, for instance, like maybe 2 in the country, maybe, if that.
Just one,
I think, and I got this experience firsthand when an uncle of mine was diagnosed with cancer and we couldn't find a PET scan in all of Ghana. Totally ridiculous. So I would definitely invest in diagnostics to help diasporans and Ghanaians alike.
Well, Koby, I give you $100 million. What will you do with it? Not the healthcare. That's what you do with it generally.
I agree with a lot of what my colleague has said, but I would, like as he said, invest in technology and training. I'll invest in three main areas: technology, training, and systems, because the systems are also not very well coordinated. I'll give you an example. We have all of these hospitals that I were mentioning all have ambulances. But when you need an ambulance, sometimes you can't find one. We have to get our ambulance system to work. And I just talked about the North, Volta region, home.
Yeah.
I used to work in the Western region before I traveled out of the country. All these places attract foreign. So in the Western region, you get Ivorians coming to the Catholic hospital where I worked.
Okay.
If you go to Tamale Teaching Hospital, they get a lot of Malians coming.
Yeah.
So if you're going to improve medical tourism, you can't do it only in Accra.
No.
You have to do it in all these places.
Absolutely.
And ensure that what is missing is closed. People are leaving Ghana to go to India purely because of heart surgery.
Yeah.
What are they going to do? We have a cardiothoracic center. Let's find out what they're doing and just make sure our cardiothoracic center can do it. Or go upscale our people so that they can. So you really have to be very, as I said, intentional about it. Decide what is missing, bring it in technology-wise or training, and make sure the system is working. If we do that, it will make significant, the amount of money we make from tourism yearly. I was doing a presentation, I was explaining to them that if you do that for medical tourism, you will be doing 8 to 10 times that amount of money every year. Every year.
Because health
is so expensive, okay? And it just pulls so many people.
Okay. So let me play the devil's advocate, sort of. What would you say to someone who says that we don't even have a basic healthcare system working functionally? Like recently, there were issues about no bed syndrome and stuff. So we don't even have that solved. Why would you now want to import people to come in to benefit from our healthcare when we don't have our sort of basic things working? What would you say to someone like that?
The people are already coming, people are already traveling here for business, for pleasure. So yes, we do have to fix our home, but we still need to cater to those people who are coming in anyway, whether or not we have a good healthcare system. So I still think we need to start with what we have, and some of those basic things like marketing, creating awareness, getting the simple structures in place would help. And we may even be able to attract even more people by doing some of these simple things. So I don't think we need to wait to fix all our problems before we say we want to do medical tourism, because the people are already here. They just don't know that these services are available.
Okay.
So to add to that point, like my colleague said, they're already coming. If you think the doctor to patient ratio is bad in Ghana, please go outside of Ghana and check. All right, it's whatever ratio you want to talk about, Ghana is at the top of it in this sub-region. So we already are doing so much better than that. Now, that is not to suggest that we rest on our laurels and then we don't do anything. No. But what we are saying is that we definitely can market better. We definitely can close the gaps. We are doing much better than the rest of the sub-region. Yeah. So we must improve it so that we get more people coming. That's what we're saying. We're not saying we're perfect, and we're very, very far away from being perfect. We went to Turkey 2 years ago because the Turkish invited us to go and come and see what they're doing with their medical tourism. And I went around the hospitals, and I came out a little bit disappointed because I was telling my colleagues that I went to that, look, these hospitals are no better than UGMC, Bank Hospital, Britannia. Some of our hospitals are nicer than them.
Yeah.
So it's really, why are we waiting? Already, some of the hospitals in Ghana are actually of quite reasonable standard.
Yeah.
And I think we should sell it properly and be more organized in the way we do it. And we must have expedited services. So if somebody is coming from Nigeria looking for, some preventative, it shouldn't be waiting in a queue. If you want to do medical tourism, you should have express services in every area so that people can pay quickly and get out. That's what these are for.
And I think generally the world at large is now more health conscious. I don't know whether COVID did that to the world, but you see now, even if you take let's say the fitness industry, I work out a lot. I see the beginning of run clubs, more gyms are opening. Like people are more conscious about their health now. So I think that even the preventative aspect of medicine is actually a big thing, a big deal in Ghana and the world globally. So we can really become a tourism hub for the world, I think. So I agree strongly to that. And the hospitals too, like I say, I am UGMC for a training program. It's a very good hospital. It's a very good hospital. And people may not know about it, but it has it offers top services. It can be comparable to other places in the world. So I think that Ghana can really become a hub where people fly in, because like you're saying, it's $1 billion industry. If we focus on it, we could become the next, in quotes, India of the world, where Ghana, we have thousands of flights coming in just to receive medical care. So yeah, I think this conversation is actually one of the things we should have. It actually opens Ghana up more to the medical tourism aspect. So yeah, I don't know if you have any final thoughts or anything you want to say in regards to medical tourism, the potential we have, and then what we can do as people and as maybe government, the private sector. How can we actually take steps to make it happen?
With the sub-region, there are 3 main countries that people travel to from healthcare. It will surprise you. Ghana in West Africa, Kenya in East Africa, and South Africa. These are the 3 countries people travel to.
So the West, the East, and the South.
But that's to say, we don't consider ourselves a medical tourism hub at all.
No.
But go to Nigeria, they'll be looking to Ghana. Go to Liberia, a lot of them come here for healthcare. We scam people and their babies coming here into Ghana. So the unfortunate is that we don't see ourselves as a medical tourism, but in this sub-region, the rest of the sub-region does. So we have to position ourselves and do what we have to do to make it work.
I think that I'm just going to say, as Ghanaians or as a country, we should also look at how to maximize staying healthy and not only focusing on curative medicine, that is waiting to be sick before you're doing something about it. We have a wide blue ocean opportunity to put systems in place to help people to prevent and also to catch things early so that we are able to work on it speedily. Like Dr. Koby said, come in, do what you have to do very quickly, and then you can go back to your country. You go back with, some form of a package, diabetes prevention package, cancer prevention package, and so on and so forth. And I think that if we look towards that, it will help not only Ghanaians, but anybody who's visiting the country as well.
Well, thank you to Dr. Koby and Dr. Asheley for your perspectives on the medical tourism, the potential there is in Ghana, and that it's a huge, the market is huge, and then it's $1 billion industry and we are taking the steps. We can take the steps necessary to have Ghana become a global hub for medical tourism. So thank you guys for watching. I hope you've learned something about medical tourism in Ghana, and that Ghana is a great place and has the great potential to become a hub where people fly in from different countries to receive medical care. It's $1 billion industry, and we have the things that are required. So thanks for watching. Subscribe to us at GIPC. We are coming to you from the Labadi Beach Hotel in Accra. So thank you for the conversation. Thank you for watching. Join us on our next episode.